So do you have any final thoughts or any, if you had to give one very important piece of advice for clinicians who find themselves being uncomfortable with the bariatric population, is there anything else that we haven't covered that you would like to share?
I think the most important thing is ask, right? It's talk to them and ask
I
them
agree.
what does it look like? Can you do these things? What are you struggling with? Maybe they're not struggling with anything. Maybe they've figured out ways that maybe you'll learn something from them because they've figured out
Right.
how to do something better because of their size. So really just talk to them just like you would with any other client and take that piece out of it. And then for my clients that are bigger, 5 minutes makes a difference. 5 minutes will change your life. And you just build on that. 5 minutes a day, whatever it is. If it's you're gonna stand up and sit down out of the chair twice in those 5 minutes. You're going to take an extra 5 minutes and walk to the bathroom. You're gonna 5 minutes of movement, moving against gravity, moving your arms, trying to, get to the edge of the bed for 5 minutes, 5 minutes a day to start that.
Muscles respond.
Yes.
They respond to challenge.
Hmm.
And you don't have to add weights and things. You can use your own body weight. One thing
Yep.
about being a lymphedema therapist that I've noticed, like if I see somebody 3 times a week, the first week or two, I'm lifting their leg and wrapping them. I'm lifting their leg. By week 3 and week 4,
They're helping.
they're lifting their leg, you
Hmm.
know? And it's just in those sessions, really, that
Yep.
they're gaining strength because I'm making them lift their leg. It's not for that long. It's repeated because I'm like, okay, lift your leg. All right, put it down, lift your leg. I'm wrapping, put it down. But that's exercise and
Hmm.
that's functional because you need to be able to lift your leg up to do a lot of things. And if you can't lift the weight of your leg, then teaching them to just like take their cane, take the
Uh-huh.
handle part of their cane under
Yep.
their foot and help lift their leg, or take a sheet, or there's different ways you can teach them to start lifting their leg until they don't need that device to lift their leg anymore.
The goal with my clients, when I'm writing goals with my clients, I never, ever, ever put a weight loss goal for my clients unless it's their goal and they're specifically like, I want to lose weight, I need to, whatever. It's always about function. And with function comes those things. That's the side effect of it, right? And sometimes they just
Cool.
don't know. If you don't know, you don't know. And that, what is it? It's that Maya Angelou thing. When I knew better, I did better. That once you understand that those little things, it waterfalls and cascades and it gets bigger and bigger and bigger, and those couple little things that you started that seem so simple and so trivial, like I'm just gonna stand up for 2 minutes today. That's my goal, is to stand for 2 minutes. It builds, and it's the same thing. Like, they didn't realize that they were working on their, thigh muscles and their butt muscles and all of those things by helping hold it up their leg for you. But all of a sudden it just started to happen and it became easier. And you're like, oh gosh, look at that. That little
Yeah,
thing made a difference. And now you're activating your muscles in a different way that you weren't before. So when you know better, you do better. And if you don't know, you don't know. That's
that's
why we're
right.
here.
Okay.